We want to talk about a fit-for-purpose healthcare workforce that is trained in this country, trained for this country, but also trained for the world. And we are joined now by the CEO of the Kenya Medical Training Colleges, Dr. Kelly Oluoch. Good morning, Dr. Ari.
Good morning.
How are you doing?
Fine.
Welcome back to the hot seat of the Situation Room. Last time you were here was what, last year?
Last year.
This thing of you coming once a year, Bana.
I should make it
kama
more.
Christmas.
Yes, try.
Kuja kama Christmas. Pana. No.
Sure, bro. Did we chase you away the last time you were here?
No.
Did we behave badly?
You are good.
Very good. Welcome back. Welcome back. So we're going to talk about KMTC, and I know the last time you were here, we were talking about how many, colleges that KMTC has across the country, how many students you have across the country at any one given time, and how many people graduate in your graduations. Hey, so there are many. We'll talk about that shortly. Sitting.
Yes, please.
The proverb to Fadali.
Yes, we are in the kingdom of Lesotho. Now, the question was asked, kingdom? I said, yeah, it's a kingdom. Established a long time ago, 1824 is a long time ago. Since we're in 2024, do the maths. How many years? Centuries?
2 centuries.
Exactly. It's old. But somewhere in between, there's a little interference. There were citizens of that particular country who felt that, perhaps they should try something. They didn't quite work out. So we're now back to having a monarchy. All right. Now the proverb. Cattle are born with ears. Horns grow later.
Cattle are born with ears. Horns grow later. Dr. Oluoch, what's your interpretation of this proverb?
That's hard.
That's his interpretation.
People learn to listen, learn to comprehend before they learn other defensive mechanisms. Yeah.
Oh, that's very interesting. Yes, you've thrown in the horn without mentioning the horn.
Yeah.
That is very good.
You were born to listen before you fight.
Yes.
That's a good one.
Thank you.
That's a good one. So the last time we were here last year, we talked about KMTC and we were commenting among ourselves how we've seen new KMTC campuses coming up across the country. Wherever you go, you'll find a KMTC somewhere. Sindio? If you go to Migori, Dennis,
yes,
iko KMTC.
Migori ni kwetu.
Sindio?
Yes.
Iko KMTC. You go to Loitoktok, there's KMTC. You go to Tamu, there's KMTC.
Kisumu.
Hawezi kosa moja. Muhoroni hakuna KMTC?
Kisumu.
Iko Kisumu.
See, I've told you. It is my county.
Okay.
Kisumu.
In a serve your region. Very good. Watch. Doctor, you're doctor trained medical doctor or doctor PhD?
Both. I'm a pharmacist. I have a MBA. I have a MSc in industrial and industrial pharmacy, and I also have a PhD in strategy. I'm a PhD student in industrial pharmacy.
You're a PhD apili.
Yeah.
Daktari.
So, kind of postdoc, what do you want to study?
I have not planned that yet.
He's a doctor of pharmacy and a PhD student. That's our basi. Our conversation continues for the next 24 minutes with the CEO of the Kenya Medical Training Colleges, Dr. Kelly Oluoch. We are talking about fit-for-purpose healthcare workforce that is trained at the Kenya Medical Training Colleges. 87 campuses, 99 courses, 18 departments, 7 faculties, 66,807 students at present. Last week, they graduated some 12,000 of them. 21,000 rather. 85% of the healthcare workforce in Kenya is from KMTC. So, and our guest host is here, Dennis. Uko na maswali kadhaa,
Yeah, and Dr. when we talk about matters to do with healthcare in the country, with the new formation of the healthcare in the country, there is need for this information to get to the people, civic education for the citizens of the country to understand what is going on. So what is the role of KMTC in making sure that this information gets down there?
Thank you. Kenya Medical Training College, because it's widely spread across the country, we are present in 45 of our 47 counties. Now, KMTC graduates and students engage with community directly. Every single day, at least 450 public health facilities have Kenya Medical Training College students in them. Now, what we do with that widespread is very important in advancing the health agenda in the country. Particularly at the moment, we are rolling out SHA. Now, what we do is provide information that enable the public to register for SHA, provide answers to the frequently asked questions, and we also enable communities, we mobilize communities to register in SHA. Particularly, Kenya Medical Training College was assigned to counties to work with the county governments and the national administration. Those are the counties of Kisumu and Homa Bay. We have since worked with the counties to mobilize registration. We've worked with counties to ensure that there is access to the answers to questions being asked by the public concerning registration and where they can get services and all that. We continue to provide support in terms of as people register, you will find that more and more people will be having health-seeking behavior, and that means that we have to get health workers, professionals in various facilities at all levels of healthcare. Kenya Medical Training College, because of its nature, provides the highest number of health professionals at all levels, and this makes it possible for SHA to work. Additionally, Kenya Medical Training College identifying challenges that exist in pre-authorization, claims management, and certain challenges with detection of fraud and use of services within NHIF that is now defunct, and now the new SHA, developed with stakeholders a course in medical health insurance. This course is supposed to produce graduates that then support efficiency and effectiveness of the SHA mandate by ensuring that we now have well-trained people who can support in number 1, registration, number 2, pre-authorization, number 3, claims management, and being able to analyze claims to ensure if there are fraud, they are detected early, to make sure that we do not have public money being used in circumstances that are not clear, and also to make sure that we have access, 24-hour access to questions, answers to SHA, especially in terms of those who are receiving care, and to make sure that as much as possible we support the government's agenda in rollout of SHA.
Something that I've always wondered, how is it that you determine your postings? Okay, students have graduated. What is the process, and how do you go about posting them, and how do you determine where the needs are most?
The KMTC does training, but in terms of employment and posting, counties are very key because health is devolved. Healthcare delivery or services is at county level. So when we do our training, we target county demands, and so what happens is counties, we have frequent conversations with counties concerning the gaps in healthcare and what needs to be done in terms of ensuring that they have sufficient personnel to address those gaps. This week, we are going to engage with county governments in School of Government, the whole of this week from tomorrow. The reason to do that is to identify challenges that counties are facing in terms of human resources, the gaps in skills, so that when we do our training, we do training focused on challenges that counties are facing. Now, that determines distribution of human resources for health throughout the country. We have counties that have high levels of disparities. Those are counties in arid and semi-arid areas like Lamu, Kwale, Mandera, Marsabit, Turkana. And so in these counties, we have to specifically look at what kind of healthcare personnel do they need and how do we train to target their demands, ensuring that at least residents of those counties are able to be admitted at Kenya Medical Training College, and they get opportunity to train and go back home to provide those services. Particularly, we have challenges in maternal, newborn and child health in these counties because of access to skilled deliveries. So we have to make sure we have personnel trained at Kenya Medical Training College that we also engage counties to employ so that they are able to address those specific key challenges that those counties face.
And Daktari, as we talk about local placements, we also understand that you have international placements of students, and there's collaboration in that sector. How does this then affect our local placements and our healthcare locally?
We have a very high rise in demand for KMTC graduates out of the country. And what we do is, because we're able to produce sufficient numbers to support the local economy in terms of human resources for health, then we're also happy to ensure that we accelerate preparation and support for those who want to work out of the country. We do it in several ways. Traditionally, KMTC does not train languages, but now, because there's demand for graduates of KMTC in line with our vision of fit for purpose human resources for health in countries that are not English speaking, like French speaking countries, German speaking countries, Arabic countries, and now even our neighbors, that is the Ethiopia, requires specialized health workers that we are able to produce. So we have to adjust to the situations where we are right now. And what we do is we are able now to train, and we actually do train French, German, Arabic, Amharic, and these ones are supposed to help our graduates be able to work in these countries which are not traditionally English speaking. Secondly, there's a lot of demand for health workers in US, Canada, Australia, New Zealand. And for them to work in those countries, they need to do an exam which is called NCLEX, National Licensure Exam for nurses, registered nurses. This exam initially was being done in South Africa and India. Now, what happens is that we, together with the Department for Diaspora, worked to convince Pearson VU, an examination providing organization, to set base in Westlands. So graduates who want to sit this exam need to be prepared for it. So Kenya Medical Training College has a short course in preparation for NCLEX, and to make sure that as many of our graduates, by the time they're graduating, are ready for this examination, we have introduced it at third year level, so that they are able to access the training at a very subsidized cost when they are still continuing with their education. So when they finish and they register with Nursing Council, then all they need to do is register to do the exam at the NCLEX Pearson VU Center in Westlands, and they are ready to work in other countries. So why do we do this? We are cognizant of the fact that not every graduate in Kenya we produce will be employed in the local economy. We are also cognizant of the direction government is taking to provide jobs not only in the country but be an enabler for job seekers outside the country. This is very important to an economy like ours, which is struggling, because now the biggest foreign earner is from remittance from those who are working out of the country. So Kenya Medical Training College in the last 2 years alone has been able to process over 6,000 certificates for those who are going to work out of the country. This year alone, there's a big spike. We have processed 3,053 papers for those who are working out of who want to work out of the country, essentially providing a platform for them to start their career. This is good for the country also. The reason why it's good for the country is, number one, we're able to get foreign a stronger currency because of that foreign exchange capacity to earn. Secondly, these people not necessarily work in those countries the whole of their life. When they come back, then there's the skills they gain from those countries that we may not have here, and they help infuse that skill in the local health setup, and therefore making sure that we are not only inbreeding in terms of skill base, but we're able to get skills from those who have practiced out of the country. This year, this week, as we go towards celebration of Jamhuri, the country is focusing on labor mobility. Today alone, I think up to Wednesday, the president will be holding town hall meetings at KICC to discuss on the situation of labor market, both in the country and out of the country. Kenya Medical Training College is a key player in this discussion. The reason is that we produce the highest number. Even in terms of graduation, there is no university or college that graduates the number that KMTC does. And therefore, we are not just interested in the numbers of those we graduate, but we are interested in those who we graduate getting meaningful employment. We've also started doing health entrepreneurship as a course, part of what the graduates are going to graduate with, so that we are not only just asking people to be employed, but also to provide employment, because we have courses that enable people to really be employers in Kenya Medical Training College. So we look at employment in a very dynamic way, not just in terms of people getting to be employed, but how do they become employers? How do we get people to work out of the country, and how does this support the institution to grow? We are also proposing in the upcoming policy for immigration in terms of health workers, because it is very costly to produce a health worker, that there is an introduction of a small levy that enables organizations that produce health workers for other countries like MTC to be able to continue to equip themselves for that role by enabling them to get resources, additional resources that enable competency to be developed both locally and internationally. So we would want to advance this also.
You've talked about the costs. Yes, it's I can imagine it's quite costly to produce any of these healthcare workers, and especially when you set up all these campuses across the country, you have to equip them. If you want to make sure that your lab people know and they are using labs, then you have to equip all these. Where does KMTC get its money from?
Kenya Medical Training College gets its money first from Exchequer, particularly in terms of remuneration of workers, both lecturers and non-lecturers. Then we also have what students pay as fee, and this is, we call in government, we call it A, appropriation in aid. That is money that you collect and spend at source. And then we have a very robust resource mobilization department that we do proposals, we engage communities, and we also work very closely with counties and NGCDF. Like most of the campuses you're talking about, whether you're talking about Makueni, Wote, whether you're talking about Narok, the infrastructure has been put up by NGCDF or county governments at very heavy capitalization, and that is because of our capacity to collaborate with the various stakeholders. So we realize that as an institution, we will no longer so much depend on the exchequer for resources, and therefore sustainability becomes a major strategy for KMTC in terms of how else do you ensure that the institution is sustainable in the long run. And here we mean it must be financially healthy. We must reduce the amount of resources we are expecting from the treasury, and we must be able to look for these extra resources to support the institution to grow. But even so, whatever we receive both from national government and stakeholders and through resource mobilization, then there is a necessity to always ensure that there is a proper stewardship of those resources to prevent wastage, to prevent loss, and to ensure that we optimize on each shilling to improve the standards of training. And therefore we have sufficient mechanisms. Now what we do at Kenya Medical Training College, we have an ERP, Enterprise Resource Planning, that ensures that we are able to enroll all students on a platform, ensure that we track fee payments, we are able to track expenditure, and to be able to we also track teaching and learning to make sure that we are not losing students through the way because of inability to ensure that they are properly taught. So we must make sure that the stewardship element is properly taken care of, and that is what we do on a daily basis to make sure we have systems, structures that ensure accountability of the meager resources we have. Yeah.
What's your recurrent expenditure annually? If we remove salaries are paid from the exchequer, right?
Yeah.
So if you look at everything else, just keeping the lights on, keeping the water flowing, keeping the food for the students and everything else, what's our recurrent expenditure looking like?
Recurrent expenditure means both salaries, what we call personnel emoluments, and operational costs. And the total amount that we use in a year is close to 6 billion in both payment of health workers, of lecturers, and also ensuring that we're able to make the lights on, taps running, insurance paid, and buses on the road to ensure students reach their destinations and all that. Yeah.
And how much are you raising?
Together with the development, what we call capital expenditure, the total budget for KMTC is close to 9.6 billion.
So around 3.6 is development expenditure, right? Are you able to actually every year raise this money?
We usually experience a lot of deficits because exchequer remittance has progressively reduced, and so what we would essentially be using to make sure development is done sometimes goes into recurrent, especially payment of health staff over and over again, and that reduces what we would spend ideally on ensuring that we have development taking place. We raise part of it comes from government, but definitely our capacity to perform is also dependent on the overall economy of the country, and it is also affected by certain arrangements in the economy like HELB. So when HELB is affected, we also have challenges in revenue generation, and that would also essentially affect students being able to complete in time. So currently we have 95% completion rate, but this is likely to be affected if we do not have the HELB issues resolved. Yeah.
How is it that the remuneration that people who work, the employees at KMTC, and then those who graduate, what's the process of determining what it is that they should be paid once they enter the job market?
The labor dynamics. Number one, you see, labor depends on basically where it's being provided. In private sector, it is pretty known what health workers receive at various levels. At public facilities, it is already, people are organized in job groups. And there's entry job groups for graduates, entry job groups for diplomas and all that. But again, there's also the other actors that determine wages, like labor unions. If you have strong labor unions, then the labor market becomes a bit distorted, because they will bargain for more than what is possible, and what to when they withdraw labor, then the repercussions, especially in health, is quite a bit.
Yeah. Actually, I need to pause there. The distortion you speak of may exist, but they bargain and they agree, don't they?
You know, I want to tell you something, that health, by its very nature, being an essential need, withdrawal of the same has a lot of repercussions. Some of the agreements are made to enable reinstatement of services.
Under duress.
Yes. They do not reflect the actual economics and how it should work. And so what that means is that money that would have been used previously as planned, let's say to buy, let's say, an X-ray machine or a CT scan, is now being diverted to provide for a service like paying health workers. That essentially distorts. You know, now you have workers, but you do not have equipment. So the whole issue is very dynamic, and it basically requires more planning. Like there's need to have things like labor councils, where employers and employees basically engage on a monthly basis before a crisis develops, and you can see what is available in the basket prior to organizing industrial actions to see that it is sustainable.
Hoping that everybody is actually coming there with clean hands and transparency.
Of course.
Dr. Ali, thank you very much for joining us.
Yeah.
Dr. Kelly Oluoch is the CEO of the Kenya Medical Training Colleges.
This is the Situation Room, the only way to start your day.